Okay, here I Idranktheseawater with special guest, Doctor of Mind.
Hello, everybody.
So, this is the second of 3 videos we're going to be doing. This one is going to be on self-injury. So, the first question is, how do we know when it is the right time to go to the hospital?
Well, that's a very important question. Because self-injury overlaps with suicide. Like, for example, you got to make sure the patient, that's not a suicide attempt, actually. Because if it's a suicide attempt, then you should go to the hospital right away. But oftentimes, self-injury is not a suicide attempt. In fact, it's more often not suicidality. But the first thing you got to figure out, and to answer that question, is if they're actually suicidal, if it was a suicide attempt. Other things I look at is what kind of self-injury. Like, if you're going to cut your wrist with a razor blade, okay, but if you're going to use a big dagger and go this way, then, you know, that's serious. That suggests more psychopathology, and I would want someone to probably go to the hospital if it was that kind of an intense self-injurious behavior. But other things like cutting, carving, scratching, burning, oftentimes they're a symptom of some other mental illness or problem that needs to be addressed in depth. So many times you don't have to go to the hospital, but that doesn't mean you have to pay attention. That's a cry for help from the person that needs some help. So, but
okay. And what about chronic symptoms, like if someone, even if it's just cutting and they're not necessarily veins, well, and it's chronic, would you go to the hospital for maybe to deter the problem?
Well, it all depends where they are, actually, in the chronicity. I want to make sure the patient was worked up properly and there's not a medical or other cause, because, you know, self-injury is associated with very bizarre disorders like phenylketonuria. These are genetic disorders where self-mutilation is one symptom, but they also have other things like serious mental retardation or metabolic disorders. Yes, head banging. So what you want to do is just make sure there's no medical cause. How many people actually know there's a medical cause for that? How many years are you going to go by and let the person hurt themselves without actually getting checked? Okay, so assuming they got checked and it's not medical and it's psychiatric and chronic, here's when you worry. When there's acute on chronic. You know what that is? That's like chronic, but also the following things like more substance abuse, worse depression, stopped your psych meds, broke up with your boyfriend, filed bankruptcy. If you got those things on top of the chronic, that makes me want to get the patient in to treat the acute on chronic phenomenon. You can reverse the acute stressors. So you don't just say, oh, that's cutting, it's for attention, or it's not serious, and ignore it. But technically, you're right. People can actually go in, attempt suicide, slit their wrist, get stitches, and then they get sent home 3 hours later. They didn't even get the treatment for the problem. So it depends on what context and where they are in that.
Okay. And if someone is cutting for attention, how should that be treated?
Well, I would talk to the patient and really find out, because again, you don't want to just keep this going and untreated. There's very good therapy for that, medication and such, so I would really want them to see the doctor. I always tell my patients to come and see me if they start cutting, or they haven't done it in a while and then just start it again. Maybe they haven't done any burning or carving since they were a teenager, but now in their 30s they start doing it again. That's when you come to the doctor to get attention. It's a cry for help for some other thing going on. And it's also related to substance use. I actually have a cutter who cuts when there's no heroin. What? That's right. When she can't get heroin and goes into withdrawals, or runs out of her OxyContin, she will actually cut herself to cause endogenous release of opiates until she can get her next fix.
Makes sense to me. I've never taken drugs, but makes
you
sense
can
to me.
see, yeah.
Yes, no, it does. It makes sense.
Yeah.
So I can see where she was going with that.
There's a biochemical basis for that in that the dopamine and mu opiate receptors and the dopamine receptors are interconnected, related. So there's actual neurochemical basis for that.
Okay. What kind of meds would you suggest, like for self-injury?
Okay. Most people say, oh, don't give them meds, they'll be worse. It's like, same thing with hospitalization. Oh, don't hospitalize them, they'll regress and it makes them worse. Okay, bull. Because what I look at is that impulsivity. That's impulsive, okay? So what I like to do is use meds sometimes to help that. Oftentimes there's mood instability and like affective instability. So essentially, in the most worst case, I will use double mood stabilizers like lithium tegretol, lithium lamictal, tegretol, two mood stabilizers, double mood stabilizers, and on top of that, under stress, a major tranquilizer like quetiapine, olanzapine, risperidone, or a minor tranquilizer like a benzo. But you got to be careful. So there you go, and everything not as aggressive as that. So the worst case, I'll use lithium, Depakote, maybe a little Risperidol, and some, right? So you can aggressively treat that if that's what's needed. Now, there are cases where I guess, you don't want to treat it. What if the person's a suicide risk? You got to be careful giving them all those meds. They have a higher rate of suicide. So, there's some practical aspects to that, but I was just answering the question. There's good medication.
There is good.
The main thing is if you're on the wrong one, that's bad. Like, say Prozac makes you want to cut yourself. See, that's an adverse drug reaction, and you need to go to the doctor and get it changed.
I'm on Prozac.
Does it make you want to cut yourself?
I don't know if it makes me want to cut myself, but I was cutting before the Prozac, so I don't know.
Right, because oftentimes if there's depression or anxiety, it'll help decrease the cutting because you're treating the depression, let's say, or bulimia, or whatever, PTSD, whatever reason the person's taking the SSRI, like Prozac, that could help it. But if you all of a sudden, say you're a cutter, they put you on Zoloft, and then you want to rip your arms out, that's a dangerous side effect that needs to be addressed right away.
Okay. And is the hospital the right place for a cutter? Like, if they get inpatient for a period of time, is that the right course of action for them, or?
I see too many cutters get turned away and then kill themselves because they didn't get treatment. So I tended to admit many patients. That's why I don't work there anymore. Because the census would be high because I really cared about such patients. Because I know, again, acute on chronic. Okay? It's not just that, it's what else is happening. Were they on lithium and ran out last month? And is it May the highest rate of suicide all year long? These are the factors I look at for hospitalization, not just the cutting, it's everything else. The drug abuse, the medical problems, the psychosocial stressors, the risk of the person killing themselves, which most people probably don't check. They just have a prejudged view that they're just attention seeking, and then this is the one that, I guess in some cases, if you admit them, they get worse. it makes them worse. You don't help them.
That was my next question.
Yes.
So why do people believe that? Like, it will get worse. Like, sometimes when I'm admitted that, like, one of the psychiatrists, he sends me away.
See?
Well, whereas the other ones, they keep.
Right, because it depends. I bet the one that keeps you, I'd go to. The one that lets you go, I'd get a second opinion, because they probably don't know what I just said, but that guy does. And it depends. Sometimes you don't have to admit the person. Just for cutting like that by itself, you know, that's not a disorder, technically. But again, it's a symptom, a cry of help for something. So I definitely, and by the way, they have the third highest rate of suicide, self-mutilation cutting. And that's often overlooked because you associate it with borderline axis too, and that is also discriminated against, and they don't want to treat that, and then they don't admit you for that, and that's the same stigma. So the problem, though, people don't know is they actually have a very high rate of suicide. So
yeah. Well, most people think that it is suicide, so they probably would think it's the same thing anyways. Is there some kind of psychological reason where like, some people have, like, very mild cuts, very surface, while other people, they cut deep enough to be...
Yes, that's a great question. I just had a patient who, well, I was just being neutral. There was a person that, say you're taking high-dose stimulants, like Strattera, say 4 times the recommended dose. It makes you want to cut yourself or stab people. Okay, so stimulants can make you want to cut yourself and stab yourself. And so can methamphetamines, like my famous YouTube video on meth, where I think I was wearing this tie. The meth is one of the most common causes of nasty hurting of yourself. Using a dagger, doing deep, multiple cuts. Okay, so that's one cause. Another cause is, you know, some people can go crazy. One time I had a patient take blood thinners, then go in the bathtub, and then slit all 4 of her limbs. That's pretty serious. So, you know, what was it? I'm sorry.
As to why some...
Oh, yeah, so there's drugs can make you do that, psych meds and street drugs, and other psychosis. See, that's a great question. I like to match the instrument to the injury. People who are psychotic don't know what they're doing. They'll use a dagger, a sword. I had a guy with a sword, like, slit his neck. He was hearing voices. So the degree of bizarreness to the self-mutilation suggests the other mental illness. For example, genital self-mutilation is common with schizophrenic, where they cut their penises. So it's very important to understand what was used and the pattern of injury in a forensic sense.
Okay. Do you think it's good that so many people on YouTube are starting to talk about self-injury, or do you think that it shouldn't be talked about, like there's triggering videos where people cut themselves and they put their cuts in the videos? Do you think that it's equal and, like, that it shouldn't be talked about so that people don't get influenced to do it?
Well, we're pioneers in the field, like yourself. That's why I was attracted to coming and doing this interview. It's people like us who other people then figure out what's appropriate and what isn't, because this is so cutting edge and trend setting. I don't think there's enough data out there yet. But I feel that you can't censor thoughts and knowledge, and the ultimate way to get this is to talk about it and understand it. So, you know, I'm kind of in favor of it. But like on my own YouTube site, you have to have disclaimers and know what the current situation is. Like, I tell people, don't use my site for care. It's just an entertainment site for now.
Information.
Yeah. So remember when it first started, they didn't have laws on bullying, computer bullying. That's really they're making a lot of laws now, and you know, I think both of us as initial YouTuber trendsetters were subject to that, and now there's laws against that. So I think time will tell, but be careful now. You know, be careful, but I think it'll fit in, because mainstream academia takes too long. This allows the patient or consumer to get direct information when they need it, because remember, this is still a taboo subject, and so people might only feel comfortable watching it on YouTube.
That's true. That makes sense. And privacy. Do you think kids in school should be educated about cutting, or do you think that learning about it from the education in school will actually be damaging and cause them to cut themselves?
No, I think it's so prominent and so, you know, common. It should be discussed, definitely, just like with sex education, mental health education, and that should definitely be a topic. Because just think of all the kids who do that. It's an epidemic. They're upset, they're in pain, they're in emotional pain from all kinds of problems. So it's an epidemic. Most of my patients admit to doing that, especially early in life.
Okay. And how should someone tell their family about their cutting?
Well, you can hide it, but you might want to tell them, because you'll get help and get treated and have a good life. If you try to hide it, like I've had women cut up in their deep thighs where no one can see it, and you know, they'll have tons of, well, then you have the opposite, the hesitation marks most of the models have for when they were younger and they broke up with their boyfriend, slit their wrist. Well, then they grow up and they got this little scar here, and it's called a hesitation mark that you can cosmetically fix. So, but if you're burning yourself on your thigh so no one can see, here, I say you tell someone right away, because it's most likely due to some medical substance abuse or psychiatric problem that's treatable.
Okay.
Treat the depression, you stop cutting as much. Treat the whatever it is, voices telling you to cut. You stop the mess, then you stop cutting. That kind of thing.
Stop the problem first, and then you can stop the symptoms.
Yeah.
Okay. Well, actually, you mentioned this earlier about schizophrenics cutting their penises with the genital self-mutilation.
Yeah.
What do you believe are all the causes to that?
It's mostly psychotic, I see, most of them, or highly neurotic. See, women get a lot of pelvic surgery. It's a lot of neurotic issues, they need a lot of psychotherapy before rushing to get that surgery. There's all kinds of polysurgery, but the classic thing is the male schizophrenic cutting his penis. That's so common.
Why would he do that?
Voices telling him it's too small or deformed. This kind of thought process. It's interesting. It's an important symptom because you can really damage your GI tract and genitourinary tract, and then could really get sick, like recurrent infections and such. But most of my patients who mutilated their genitals were actually males who cut their penises. Now, one time I had a female patient. This is, again, due to delusion. She thought she was possessed by the devil, so she put a cross in her vagina to try to protect her from the devil. You see that autistic thinking that's classic in schizophrenia? So it's very important to figure out what's going on there.
What about, like, in sexual abuse?
Sexual abuse is common, and repeating that due to sexual abuse is highly associated with genital trauma.
Yeah. Okay. So that was actually my final question.
Great. That was very informative on self-injury. You asked very good questions.
And very good answers. So that was Idranktheseawater interviewing Dr. of Mind.
Hi.
Psychiatrist. specializing in psychopharmac therapy. So if you guys are interested in seeing more of him, you can do that. You can I'll put the link in the information where you guys can go see his channel. He talks about different kinds of medications, about different kinds of treatment, about different mental disorders.
All right, thank you, and make sure you subscribe to Idranktheseawater. It's one of the best channels out there. It's informative, knowledgeable, understandable. I love it.
Perfect. Have a nice day.